what makes you get all faculty members, parents, and my fellow students. Myself, question 6 the faculty topic. This is the Jain College.
I cannot hear.
GSS Youth Red Cross Unit. On behalf of our college and YRC unit, I feel extremely glad to render a hearty welcome to you all. As light removes darkness, so prayer removes ignorance. Let us commence this informative session by seeking the Almighty's blessings. A warm welcome makes an occasion more special. May I request Dr. Visalachi Madam, Chief Coordinator of GSS Youth Red Cross Unit, to render a gracious welcome to all and read the credentials of our prominent speaker.
Thank you, Neetu. Good morning to one and all present here. I am Dr. Visalaksi, Assistant Professor and OERC Unit Program Officer of GSS Youth Red Cross Unit of GSS Jain College for Women. It gives me great pleasure to welcome you all for this health conscious webinar on the title Cancer Awareness Program, which is organized by GSS Youth Red Cross Unit. I am very much excited to welcome our guest of honor, Dr. Sarita Damodaran, Clinical and Radiation Oncologist, Bilrath Hospital, Chennai. Hearty welcome to you, ma'am. It is my immense pleasure to welcome our Honorable Secretary, sir, respected Principal Madam, dear faculty members, parents and beloved students for this webinar. It is always inspirable to know the successful person's credentials. I am happy to introduce our guest of honor, Dr. Sarita Damodaran, to the gathering. Madam Sarita has done her MBBS in 1990 at R.J. Kaur Medical College of Calcutta Medical University, her post-graduation from Adyar Cancer Institute and her MD on Radiation Oncology. Madam has worked in Adyar Cancer Institute from 2000 to 2010 and from 2010 to till now working in Bilrath Hospital. Thank you very much, Madam, for accepting our invitation and gracing this session. Yeah. Once again, welcome you all and thank you. Thank you.
Thank you, Dr. Visalakshi. Am I audible to all of you?
Yes.
Yeah, okay. It is really an honor to be amongst the youngsters who are somewhere interested in some way interested in a lot of social activities, and definitely Red Cross is one of the a very unique organization which is common to both schools and colleges, and I'm really happy to be a part of this event today, organized by you, because I too was a member of the Junior Red Cross when I was in school, and I'm really happy that today I'm able to do something here, and the thought of having a program of this nature itself needs to be really appreciated, because I'm not sure whether the youth of this country would be really keen to hear topics on such awareness. Because, but I'll tell you one thing, as in how youngsters get involved in any event. I am now understanding and seeing that they go in great depth and detail. And we always tell, when we want to eradicate literacy, we should target the women at home, so that or the girl child. So that is one way of getting a family to become much more academically evolved, and the next generation would definitely follow suit. And once we educate the lady of the house, the entire family is a lot more better. So this is the thought with which some time back, when I was in school, everybody used to speak like that. But today I'm seeing the youth of today are into a lot of activities, and I really appreciate, and I'm really very happy to be amongst all of you. And I thought, when they were asking me for some PowerPoint presentation, I was wondering if each time when we give, it's like giving a lecture, another lecture to attend. And after the lecture, sometimes remember few things and sometimes forget few things. And uh, I thought, let us not make it in that routine way, and move a little out of the norm, and go through the session in an interactive way. So, but before that, I would like to talk a few things regarding, what are the thoughts that we get whenever we think of the word cancer. you know uh, that is a very dreaded word, and today I am seeing a lot of people talking about cancer. Yes, yes, Neetu.
Our prominent chief guest with a memento of appreciation. May I request Dr. Visalachi Madam to felicitate our guest with a memento of appreciation?
Thank you, Dr. Visalakshi, for that memento, and thank you, dear friends, young friends from the college, faculty, and parents, for this token of appreciation. Can I continue, Neetu, with my talk?
It is time to acquire knowledge on keeping our hearts healthy and strong. May I take the pleasure of requesting the guest of honor, Dr. Sarita Ma'am, to take over the session and enlighten our minds with her speech. Over to you, ma'am.
So all this while, I had been talking a little bit about the Red Cross, and how I was involved in it as a junior Red Cross member in my school time. And I'm really very happy to be a part of this event today. And I appreciate the organizers of the college and the NSS unit, for the Junior Red Cross unit, for having thought of cancer as one of the topic. It's sometimes a little depressing for everybody to talk about cancer, but it is also essential that we understand the what exactly is cancer, and why are we really dreading it. Because whenever we hear the word cancer, we are worried. There is a lot of anxiety. We think the person will be in pain. We think it's something very incurable, and it is a very unpleasant thing. So these are all the thoughts that come when we think of just the word cancer. But I, at the end of this session, want to change these thoughts, and put in some positive thoughts regarding how we shall deal, and how we can deal, and how we can prevent cancer itself. So that is what will be the key to overcome this fear that we have regarding cancer. So the incidence of cancer is rising, as we can see, maybe due to a lot of reasons. But very simply, if you put it across, it would be bad food habits, maybe because of the pollution, and of course, increase in lifespan. Today, we do see a lot of people in 80s and 90s. uh, and it is not that they are the only ones who are having cancer. We do have patients right starting from the age of 2 to 3 having cancer. So, but then there are certain cancers that come because of age-related issues. So that we could contribute, to increase in lifespan. The other thing is technologically advances, have curtailed a lot of infectious diseases, be it cholera. Now, even though we had the what to say of lot of floods and all that happening, it's still diarrhea and other infectious related diseases like cholera and all have come down because of the awareness, because of we are having a proper restrooms and etc are being made available even in public. So the public restrooms are a little, the infrastructure has improved. So on the whole, the infectious disease aspect has come down. But then bad food habits are in the rise because of maybe a rising income we see in small units, because now the families are not joint families. So we do have very small nuclear families, and eventually the children, when they attain the age of 20s, they start earning, and sometimes that income is really not required in the family. So a couple of months they tell it is okay, you can spend your money for your needs. So automatically the children go to the get-togethers, and there are a lot more events happening, parties happening. Whenever there is a gathering, we do understand that easily the bad foods come into play. We have moved out of our food habits. The traditional food that we eat is definitely not the party food that youngsters would like. So maybe we should try and change the traditional food to suit the party needs. But whatever are the party food now are mostly of the Western kind and a little high on a lot of salt and a lot of gaseous items. So these are definitely not very healthy in the long run. So that is the reason why there is a rise in cancer because of lifestyle itself. The other thing that we need to know is what are the kinds of cancer? See, where all can we have cancer? Is it possible to communicate with students who are there in the attending the chat? I just want to know what are all the kinds of cancer that you might know, because the word cancer is there, but what are all the kinds of cancer that anybody would know? Anybody can chat, type it. uh, Neetu, anybody is answering that, or shall I just proceed with the talk?
Ma'am, your audio is off.
It looks like only when I mute I can hear you.
Ma'am, managing
Okay.
by
Yeah, I can now see breast cancer, blood cancer, etc. Yes. Wow. So these are all the various types of cancer. So just when we look at it, there are, there's not a single part in the body where cancer cannot come, but there are a couple of dead tissues in the body where cancer will not come. Can anybody guess that? I really wish, yeah, mouth cancer, breast cancer, right, Purvi? Thank you for that input. Yes, all of you seem to be talking about breast cancer. I wanted to know now where cancer wouldn't come in the body. Okay, we'll leave that question as you type the answers. I understand that it is not easy typing answers, but when you ask about a movie's review, it might come a little faster, maybe. Anyway, this the different cancers are named according to the place of origin. Now, the place of origin is suppose a gland, then we call it adenocarcinoma. Okay, and when it is from a cartilage, that is the tendon which is joining the bone and muscle, the networking of the bone. It's called a cartilage. So they are called as chondrosarcomas, etc. Then from the muscles, then it will be sarcomas. Then if it is in the blood cancer, somebody had written, that would be in what we call as leukemias and all that. So these are, so there is not a part in the body that doesn't show transformation of cancer. But can somebody tell where cancer cannot come? Okay, I'll leave this question uh, like that, and I'll proceed in giving my talk. I will come back to this question again. So, incidence of cancer world over is increasing. We are saying about 25 million globally. There is an increase, and about 2.5 million in India. So this was the prediction for 2020. We surpassed that, and now we are in 2021, and we do still see a rising a number of cases. Hairs or nails? Yeah, Isha has got that right. Both of them. Yeah, yes, Isha, you're very correct. I really wish this was a classroom and we could all clap for you. And because I don't know physically if we could. Nisha has also got that right. Nail is right. So Nisha and Isha, both of you deserve a round of applause for nailing that correctly. These are two dead organs where cancer doesn't grow. Otherwise, all parts of the body, cancer transformation is possible. Now, what is this transformation? I will just give you a simple anecdotal theory. Now, all of us have a kitchen in our house, and we know our mothers are the people there, the queen there. And whenever we let or we go into the kitchen, there is a possibility of displacing certain things, and the order of the kitchen could go a bit haywire. So now when the kitchen gets a little disturbed, the cooking might or might not reflect that. But if the cooking is also taken over by the foreign body, that is either you or the neighboring aunt, then definitely there could be some disaster. So in that same way, whenever the body has got a foreign cell in our that is, a proper cell will multiply and it will die. Now when it doesn't die in the normal course, it stays abnormally there, or a particular cell does not grow to its correct potential, and it has a deviation in its function, and it functions in a very in a haphazard manner. Then that particular cell is not able to do the duties that it is supposed to do. So in that case, that particular cell becomes a foreign body or an invader to the normal cells there. And it just keeps multiplying and it occupies the entire space. So when it occupies the space of the living cells, and these dead cells, or rather cells which are not functioning properly, are multiplying in its own way and occupying the place, that is what is called cancerous cells. This is in the most simplest term that I could explain what a cancer cell is. Now, what happens is when a bundle of this comes, few of it comes, the body has got the brilliant capacity of identifying these foreign bodies and pushing them out. But whenever this doesn't happen that way, that is, it is not able to push it out of the body, then they accumulate and they destroy that organ, and they are unable to do the function. So that particular organ is unable to do the function properly. It is not able to carry out the normal function of that. Now, suppose if it is a liver, it is going to be very difficult. Liver is called the kitchen of the body. And now the kitchen doesn't function properly. You can understand from the anecdote that I told you how difficult it would be for the body to function. So this is how the beginning of the cancerous cells would work. And now when we are, now how do you feed or how do you cut the cancer cells from its growth is by, see, a very simple thing. Those tricks are called the prevention of oncology. Okay, how do we prevent? So when I come to that part, I'll tell you how we can stop these abnormal cells from functioning. But when these cells grow in large number and the organ is occupied by more of these cells, it will hamper the function of that particular organ. That is when cancer is detected. And from there, it will spread to another area. How does it spread? Could anybody enlighten me in this? You could just type out your answer. How can the cancer cell um, spread from one part of the body to another part of the body? So leave it as a question there, and I will proceed to speak about just a gist of thing. It is called caution. This is something, if you Google, you will find it is CAUTION. Okay, caution. Now, caution gives you the inner gist. Multiplication of tumor cells is, yes, that is what happens. Multiplication of tumor cells and its spread. How does it spread from one part of the body to other? That is the question. So we will proceed with the warning signals that I wanted to make everybody aware of in this talk. That is caution. Caution. C stands for change in bowel or bladder habits. See, any kind of change through blood. Pooja, you're right. Through blood, it can spread. And another, yeah. So through blood, they travel through blood. Yes, Neetu, you're also right. So I really want to applaud, but I'm not sure whether you would hear me. So whether everybody can applaud and all of you can hear. Anyway, it was nice. The answer was to the point. Through blood it can spread to various parts of the body. So that is how we have cancer from one part of the body spreading to another part of the body. Usually cancers of the breast spread to the liver, lung and bone. Cancers of the bone spread to all parts of the body. It can easily go to the liver, and colon cancer spread more to the liver. Breast cancer, I had told you, it spreads also to the lung and brain also. So these are some of the common cancers that we are dealing with. In India, we are having a rising trend now we are seeing in lung cancer, but then it's for many years it was cervical cancer, uterine cervix cancer, which was in the lead. But due to certain good hygienic practices now that and late no child marriages, etc., the incidence of cervical cancer has just dropped, and it is now breast cancer which is superseding. In Chennai metropolitan alone, the breast cancer is in the rise, and lung cancer follows. And in men, you find more of mouth and lung cancers. And a little prevalent in the elderly group is the prostate cancer. So these are some of the very common information about which are the cancers which are in the rise. So we'll go back to the warning signal. The first one I told you is change in bowel or bladder habit. C stands for change. So the change is now routine bowel and bladder habits. Somebody is frequently going to the restroom and urinating frequently. It could be a urinary infection, it could be a simple pregnancy, but sometimes it could also, if it is having a tinge of blood in it, apart from urinary infection and diabetic patient or pregnancy, it can also be some kind of also some ureteric colic, that what we call as stones, because of some stones also you could have a tinge of blood in the urine. But it can also be because of urinary bladder, okay, cancer. And it could also be because of any renal cancers. And sometimes it could be blood tinged because of cervical cancer from the vagina, could be mixed with some blood which is coming. So these are all some of the things that you should remember. The other thing is, yeah, there was a question on the stages of cancer. I shall come to that. So the first change in bowel and bladder habits. So bladder habits, I told you. Bowel habits, what is this bowel habits? Is a regular motion of your bowels, which happens every day for us. And but then when it is frequent and when it is tinged with blood, it can always be piles. That is a normal thing which we call as hemorrhoids or anal fissures. That is a cut in the anal region. That is where we pass motion. If there is a cut, there could be blood tinged motion also. But apart from these things, it can also be a sign of rectal cancer or anal cancer. So that is what I wanted to talk about in the first warning signal, that is change in bowel or bladder habits. The other thing is a sore that does not heal. Whenever there is a sore, an ulcer which doesn't heal, it could be because of diabetes, it could be because of inadequate treatment or improper treatment, etc. But apart from that, it can also be because of cancer, some kind of a small ulcer of a long duration can change into skin cancer. So we that is something which we should keep an eye on. Unusual bleeding or discharge. Unusual bleeding, unusually bleeding from abnormal areas. Now, from a nasal bleed, or a bleed from the ear, or when you're having a bleed from the nipples of the breast, or from the pervaginal bleeding. All these are because of there are many reasons. Now, in if we look at it one by one, if it is a bleeding from the nose, when some people, they go in high altitude, there is a possibility of this kind of bleed coming. And certain blood disorders can also cause this kind of bleeding. But then if you are having any kind of cancer in the nasal region also, or from the mouth, or in the we call it as inner aspects of the nasal regions, you can have this kind of bleeding. Nipple from the breast, if there is some discharges, there are sometimes with blood tint, sometimes it is because of just hormonal changes in the body. Sometimes milky discharge is due to somebody is feeding, and there is some hormonal imbalance, and that is possible. But if there is a bloody discharge, then definitely it is omnious and we need to look into it. Unusual bleeding and discharge, I have now almost covered. The other thing was, yeah, discharges from per vagina. Now you're having a bleeding regularly every month, and suppose there is intermittent bleeding, then that is something which we need to check into. It might be a simple what to say, hormonal imbalance again, but then there is nothing wrong in doing a pap smear and checking for anybody above the age of 18 or those who are married. So the other aspect of unusual bleeding is, now somebody has attained menopause. Now most of our mothers, or most of the women in the age of 50 to 55 to 60 would have attained menopause. That is all a cessation of your regular cycle. So now when that regular cycle has stopped for some time, and then you still have an occasional bleed which might be a little dirty colored, or some white discharge, or some white discharge tinged with blood, these are kind of discharges which are very ominous, and we need to definitely check. This could easily be due to some uterine cancer, so, or due to some cervical cancer. So these are some of the bleedings and discharges that we need to be aware of. Thickening or lump in the breast or elsewhere. Now somebody is having a lump in their body. See, a lot of our Indian us in our Indian subcontinent, it is very common to have lipomas or fat under our skin. Under our skin, it is actually a layer of fat. So when there is an accumulation of that fat, it could be some kind of a mass which kind of moves. Many of them have that thing, and that kind of accumulation, and it is called as lipoma. But all are lipoma or not, that we need to confirm. So any kind of swelling unusual at unusual places, or is there unusually, definitely we need to check on that. Especially in the lump, when we have a lump in the breast, definitely we need to check. All lumps in the breast needn't be breast cancer. See, there are certain other entities called, because of the fat, breast is made of nothing but fat and some glands and some tubes which will deliver the milk from the glands, so that open into the nipple. So this is what the breast is made about. So whenever we have any kind of accumulation of water or fat in the breast, it could form cyst or fibroadenomas or fat. So these are some of the lumps that we find in breast, apart from the breast cancer. Now, but how do we make that out? So that is where it is very important to know which ones are some individual on his or her in individual discretion. We cannot decide whether this is a cancer or non-cancerous. It is always better to consult the doctor and clarify those doubts. But what I am trying to emphasize here is, any kind of lumps, we better clarify it. That is what it is. And now, if it is for a woman who is under 40, then it is safer to go and consult a doctor and get an ultrasound done under her guidance, and then take a call on this. So now, if it is for some women above 40, then it is better to get a mammogram done, because now what I see in my clinic, in our practice nowadays, most of us doctors are seeing patients walking in with all the reports. So it is not like the doctor is asking them to do the investigation. Most of the time, many of them do self examination and then come. So what happens is, what investigations are actually needed sometimes get a little mixed up. So we need to know that above 40, they can do a mammogram, and below 40, it is safer and better to do an ultrasound of the breast. And always do it um, under the guidance of a doctor. You meet the doctor and then proceed for the investigation. So other thing is indigestion or difficulty in swallowing. This is something very commonly which happens, because most of us miss our breakfast, or sometimes our lunch, and sometimes even dinner. So irregular food habits, these are the one of the main causes for producing acidity in our system. And whenever there is indigestion, that is also because of increased acid production in our stomach. So what happens is, when you just touch our mouth with our tongue, the inner aspects of our mouth, you can feel that it is very soft, extremely soft. 10 times softer is our stomach lining. And in this lining, when there are repeated expression or exposure to acid, it causes ulcer, and over the time that ulcer changes into cancer. So as such, our Indian food and our conventional food doesn't cause cancer, but when we have moved out of it, it does produce a lot of gastritis, that is what we call it. And over the period of time, ulceration and cancer formation is there. So this, as such, in our Indian subcontinent was a little less, but of late we are seeing a lot of stomach cancer patients too. And difficulty in swallowing. There is a difficulty in swallowing. Okay. That is especially when there is a cancerous growth in the food pipe. They'll have this difficulty in swallowing. So these are some of the, and there is a loss of weight, disinterest in food, all these things. So these are multiple factors that can cause cancer of the food pipe and stomach and intestine too. Now, obvious change in the water. So this is O of the caution. So far I have told you. C, that is change in bowel or bladder habits. A, which is a sore which does not heal. U, CAU, this is U is an unusual bleeding or discharge. T, is thickening or lump in the breast or elsewhere. I is indigestion or difficulty in swallowing. And O is an obvious change in wart or mole. Many of us have warts and moles, for a long time. And when you see that change in size, an increase in its dimension, there is an ulceration, all these things, when there are, these are the changes that happen, that is unusual. So we definitely need to, it could be any kind of skin cancer, which we need to, biopsy and find out. Next is a nagging cough or hoarseness of voice. A lot of people have hoarseness of voice, especially teachers and singers, or people who have, especially coaches or in the fields, they have voice abuse. Because of voice abuse, you will have hoarseness in their voice. So these are usually because of some nodule formation in our vocal cords, and that can cause hoarseness in voice. Okay, nagging cough. Somebody has got a cough nowadays. Most of them are having cough after this COVID and after the rains. But a nagging cough is something which we can definitely differentiate. That could be a sign of anything in the lung. A cancer in the lung could be a nagging cough for a long time, even after treatment with antibiotics and some inhalation, etc. Even after that, when that doesn't subside, then definitely we need to look into something called a lung cancer. Now, all these warning signals, why I was trying to elaborate with the symptoms and the signs and tell you all, is even something when one of us here and somebody is telling, at least we can caution that family or that person about the possibility of ruling out cancer. I'm not asking you all to be policemen, but I'm asking you all to be aware of that this are the very important signals of cancer that the body is giving us. And many a time when we save a family, see, if the mother of the if the lady of the house is getting some kind of, she's complaining of something, and then we ignore it, because most of the time it is ignored. They'll tell, not now, we could always check a little later. Nobody finds time when some disease is in its early stage, and when they come for treatment, it is very easily curable, very easily curable. But somebody, the cancer cells have formed, the multiplication of cell has increased, the whole organ is kind of occupied with that abnormal cells, then it is very difficult, because it is very easy for it to spread to another organ. And then after that, to deal with a stage where it is spread to another organ, it becomes very difficult in treating as well as getting that person back to normalcy, so, or to cure. So early stage of the disease is very important. Now we should see what are the stages of cancer. See, stage 1 is, I'm roughly talking about stages of cancer in any part of the body, right from A to Z, except hair and nail, we said doesn't have cancer, all the other organs. So a stage 1 would be roughly, it is confined to a very small area in that particular organ. Now, stage 2 would be, it is a little bigger in dimension. And stage 3 would be that particular organ and maybe the nearby nodes might have had its, spread. To the nodes means, nodes are the area where the nearby it drains. That is, it is just like blood vessel. Whatever is happening here, it will confine. It is actually what we call it as a dam which will kind of stop the growth or the infection to spread from one area to other. But if that gets involved, then it is likely that it will send it to the next organ. So that becomes stage 3. And stage 4 would be from one particular organ to another organ, it kind of spreads. That is, from if it is a cancer in the breast, it has moved to the liver. I have got a question here. What are the transformations seen in cancer treatment at present? Okay, we will go to the treatment as we finish the staging. So these are the stagings of cancer: stage 1, 2, 3, 4. And it doesn't mean a stage 4 patient is going to not survive. Okay. A stage 4 patient, sometimes it depends on it. It is not the stage that decides whether a person or a patient will survive or will succumb to the disease. It is the aggressiveness of the disease that decides how aggressive is the disease. Sometimes a stage 1 disease can be very aggressive, and that means then that person might not survive. So it is not the stage that decides survival. So I want you all to be clear, because most of the time whenever patients come to us, they would have gone through a lot of information, and then they come and they feel, when we tell the stage, that is a very omnious factor which will decide their survival. It is not so. So it is not the stage of the patient that will decide the survival. Of course it contributes, but there are many more factors that contribute for the survival of a patient, and that is the aggressiveness of the disease. The other thing is, why is cancer potentially dangerous? Now, we spoke about aggressiveness. That is one factor which is a dangerous thing. Other thing is, where does the cancer come? Now, in brain cancer comes, or in liver cancer comes, it is okay. Certain cancers are curable there too. But in a very important area in the brain, like the cerebellum and some inaccessible areas of the brain, it becomes very difficult to treat and to cure. Similarly, in liver, when it is affecting all the lobes of the liver, it becomes very difficult to cure and heal. So these are areas where it could be a little difficult and dangerous. Otherwise, because most of the questions when the patient asks me, is it very dangerous? That is the question they ask. So I wanted to emphasize and tell you that whenever all the lobes of the liver are involved, then it is little dangerous. And similarly, in certain inaccessible areas of the brain, again, it is very difficult to cure. So we did go through what is the fear of cancer. This is to overcome the fear of cancer. We are trying to understand the biology of cancer, what causes cancer, what are the reasons for cancer occurring, and where all it can occur, where all it can happen, what are all the stages, what are the factors that decide on the curing potential of cancer. Now, the other thing is, before we go into the treatment possibilities of cancer, treatment options of cancer, I want to speak about just let's go globally and see what all cancers are common. Okay. So let's go to Australia. Just pan into Australia, New Zealand. The most common cancer there, can anybody guess? Yeah, you could type. And as I pose that question, I will go to the next question. That is, in Japan. Japan is a very admirable country for the way they have overcome the nuclear war and so many other disasters that they face every day, and they are still a very important global player. But they always succumb to one particular cancer, and that is stomach cancer. And again, why the reason is because a lot of nuclear waste was consumed by their marine life, and when they were consuming that fish or whatever was, they consume a lot of non-vegetarian food, and the reason of consuming food which was exposed to nuclear waste caused more of these stomach cancer. But that didn't make them any less, that didn't make them in any way inferior, in the sense, for stomach cancer, we look for all latest and the possible treatments towards the West. But for stomach cancer, we look to the Japanese for whatever is the latest, because they are pioneers in this stomach cancer treatment. And has nobody has answered about what is the common cancer in Australia and New Zealand? And I'll also tell you, we are also a part of causing whatever is the cancer there. That's the only clue I will give. And meanwhile, touching a little about the Indian scenario, I have already told you that every year we have, in breast cancer itself, we have 1 lakh new cases being diagnosed. Can you elaborate what exactly is bone cancer? Okay, that is a question I got. But the question I asked, I haven't received an answer. What is the commonest cancer that we find in Australia and New Zealand? That is my question. I again repeated it. Now, so in Indian scenario, breast cancer and lung cancer, no need to. Breast and lung is not the common cancers. Okay, we will. I will answer that. The most common cancer there is skin cancer, and the cause, yeah, Nitya, Losin Nitya, very good. Skin cancer, you have answered it right. That is the most common cancer in Australia. Anchal Saroj also very nice. You have answered that, skin cancer. And yes, the cause for it is the cause for skin cancer there is because they expose themselves. They like to sunbathe, and they have lovely beaches, and they do go for sunbathing. And because of the ozone depletion, they are exposed to a lot of radiation, and that is the cause for the skin cancer. And yes, I told you one thing. We are also responsible for that. Yeah, I wanted to. This is the month of November, and in a couple of months we will be contributing for the ozone depletion, and that is during the month of Pongal. During the festival of Pongal in our state, we burn a lot of plastics and a lot of used material, because the tradition of burning the used things are to start afresh. But nowadays what has happened is, that is because they've been using it for a prolonged period, but somewhere down the line the thoughts got diluted, and now for the sake of burning we burn anything and everything that we feel okay is of not use in the house. And many a time we end up burning a lot of plastic buckets and mugs and mats, etc., which is contributing a lot to the pollution and to the ozone depletion. So I request this Pongal, each member from your house, or if each one of us take one initiative, just take the initiative not to burn anything plastic. It will be a big boon to the society in large. So if it is possible by any of you to stop your neighbor too from doing that, that will be excellent. So, and maybe for 10 other friends, 10 other members of your family, or distant extended families, that will be too great. So if all of you would contribute this way, let me know, put a hooray or thumbs up sign, so I know that yes, you will do this. I can't see any thumbs up. I'm waiting for the thumbs up sign. You can type. Yes, ma'am, is from the college. Okay. So there are other cancers also that I need to touch upon, and that is the tobacco. Tobacco is again another evil which is in our society. The quid, that is whatever we chew for a long time, no? We call it a quid. So, okay, Anu, thank you. Nitya, thank you. Yeah, all of them are putting thumbs up. Joshna, thank you. Yashoda, thank you. Ashwini, thank you. Anu, thank you. Anusha, so many. Yeah, thank you. That's very nice. Nisamuddin. So a lot of people are taking a step forward. So at least 10 of you, and I feel very nice. 10 of you are going to be vigilant this Pongal. And yes, that will help in reducing the pollution in our in the world. That's not just our society. It's a small contribution from us to the world. So similarly, tobacco is again another evil. This quid, the betel quid, when it is kept in our cheeks, usually that's where they hold it for a long time, and then they chew whenever it is possible. So you see a lot of cab drivers or auto drivers, and a lot of youngsters now using this tobacco chewing. So this quid, when it has, you name it, all the possible poisonous and dangerous chemicals are there present in this quid and tobacco. And when it is kept for a long period in the mouth, it kind of erodes the soft tissue of the inner lining of our cheek mucosa. That is, this is the cheek, the inner lining of our buccal mucosa is kind of eroded again because of acidity. And prolonged exposure causes ulcer, and over the period of time, you can have cancer. Many people do tell me, some of my oral cancer patients do tell me, madam, I never smoke, I never chew tobacco, but still I got cancer. How? Why? Now that is again a simple reason. If your teeth is uneven, and if there are sharp tooths and it is repeatedly causing ulcer in your buccal, in your cheek mucosa, the inner lining, then that too can cause ulcer and later on cause cancer. So this is again another cause. So all what can we do for crooked teeth or sharp tooth which is causing this? All you have to do is visit your neighboring dentist and get it smoothened. So that will prevent this problem. So these are some of the oral cancers: breast cancer, lung cancer, and skin cancers. All these cancers we kind of dealt with in depth. Now, let me talk how to prevent all, or how to detect all this. How do we diagnose all this? See, it is very simple. All you need to do is a simple chest X-ray can show something wrong. So when many a time, in many meetings, in many forums, people do say, doctors keep writing a lot of investigations, etc. It is not that. When you do a simple X-ray chest, we can make out if there's something wrong. If there's something wrong, maybe you can further investigate and find out if there is a cancer or not. Similarly, blood tests can reflect if there is something wrong in your body. And any test done now for a cervical cancer or a uterine cancer, a pap smear will show if there's something wrong. Again, a breast self-examination before you do a mammogram or an ultrasound. When you meet the doctor, she will definitely examine the breast. These are very easily detectable cancers. The breast cancer, the uterine cancer, etc., very easy to detect, and it is very simple. So self-examination is something which all of us should learn. Now, how do we self-examine our breast? So if you just think, the breast is as a simple round, a clock. So in a clock, you can divide it into four. Okay, so you can divide it into 1, 2, 3, 4, and the middle portion as 5. You use your opposite hand, opposite palm, to examine 1, 2, 3, 4, and 5. Similarly, for the other breast, 1, 2, 3, 4, and 5. Once you examine both the breast, definitely there are some lumps or something unusual. It will hit your hand, and then you definitely consult your doctor regarding that. But now, self-examination, when should we do it? Definitely after your cycle. Sometime in the after you complete your cycle, if you do that, would be right, because just before your periods or your cycle, if you do it, you will find a lot of swelling in your breast. So it is best to do it after the cycle is over. And definitely it should be done in two positions. One is in standing and the other is lying down. So when you take a bath, you just need to check. And when you are going in the night to sleep, just when you change your clothes, you can again lie down and check. So that is all is needed for a breast self-examination. There is no big hue cry about it, or there's nothing to be ashamed about our breast, because it is nothing but an organ which is made of skin and fat and some mammary glands which secrete milk, and the milk is and I wanted to also tell you, whenever I wake up or sleep, I have stomach ache. What can be I'm getting questions. I also tend to have stomach ache any time of the day. Is this a concerning issue? Whenever you are the stomach aches, as I said, could be an indication for gastritis, because that's how we will tell my stomach is paining or there is some kind of an indigestion. So the main cause could be because of improper food habits, improper timing of food. And now I want to go into what should we take to prevent these kind of gastritis or increase in acidity. Definitely consumption of water, definitely consumption of buttermilk. Buttermilk is nothing but just a teaspoon of curd with a lot of water. At least if in a glass, if you're putting a teaspoon of curd, the three-fourth or the rest of the glass should be filled with just pure water and some salt. This is more than sufficient to have a buttermilk. I have a lot of people telling me that buttermilk is not suitable for all weather conditions. It is not so. If you are not taking a chilled one, it is not so. It doesn't really cause. Many people say that I have asthma and it doesn't suit me. Yes, then fine, you find some other probiotics, or something which will is akin to the bacteria which is present in your stomach. So intestinal bacteria that prevents and cancers and a lot of acidity is lactobacillus bacteria. Now what is that and where do we get it? Is a simple pure form is buttermilk and nothing else. So this is like a heavy recommendation for buttermilk, but that is the purest form of the bacteria that is available to us in our own food. So this is not there world over. It is there in our Indian traditional normal food. It is just that we have moved out of it and we are not wanting to go back to that. So if you are trying to put in a glass of buttermilk in our daily diet, it will go a long way in settling a lot of enzymes in our stomach, and that will correct the digestion, and that will give the strength for the abnormal cells. I told you at the beginning of the lecture, the abnormal cells which are there, how they grow and how they thrive. So the way that we can kill them is by making the normal cells much stronger, to push them out of the system. So how do we push them out? You should be strong with a lot of fruits and vegetables which have a lot of antioxidants. So that is what will reduce the cell damage. See, aging is a normal process in our lives, but it's that aging is a beautiful process where the dead cells are removed by itself and the new cells are still forming, and they have a lovely synchrony and they work that way. But when in a young body itself you have a lot of dead cells or abnormal cells, they cause a lot more damage. So how do we correct that? Is only due to with certain diet. So what are the diet that we should use? What are the kind of food that we should take? Plenty of buttermilk, a lot of water, a whole lot of fruits and vegetables. There should not be any kind of what to say, restriction in this aspect of taking fruits and vegetables. So yes, again, another thing I wanted to stress is whenever old food is consumed, it and it stays in the stomach for a long period. A very simple example of colon cancer. This is the last part of the cancer that you need to know. Colon is the gut. The gut, finally, all the food is collected here. And unless and until everybody, a person has a normal bowels, it does not come out. So when and how should how many times in a day should one drink water? How much is the fiber food that one should take to make sure that these bowel habits are normal? Is always a question that a lot of avoided to prevent individual. There's a question from Pooja: which food item should be avoided to prevent individual from cancer? Okay, you are asking about avoid which foods to avoid. Okay, I'll come to that. Now I am talking about what are the foods that you should take in large quantities to prevent cancer. So that as I told you, I'm now revising it again. Plenty of water, fruits and vegetables, lot of walnuts, and all other kinds of nuts, which will have a good amount of antioxidants, and buttermilk. So this is in simple five things that I told you: water, buttermilk, fruits and vegetables, a lot of nuts, and those are the antioxidants. A lot of greens too. Now, which are the food that we were talking about normal bowls before Pooja's question. We were talking about normal bowls. The normal bowls are only possible if there is a good amount of fluid and good amount of greens in our diet. So only then the bowls are regular, and the food is digested and expelled out. Why I'm talking about this as a very important aspect is nowadays we see a lot of colon cancer in increase because the kind of food that we eat are quite toxic. When you leave it out of the fridge, you do know that bad food is not good. So it's the same way in our intestine. When it is lying there for a long time, it is going to be toxic, especially if they are non-vegetarian food. It is going to be even more toxic, and when that is exposed to our intestinal walls, it will cause a lot more damage and will cause cancer in the long run. So having toxic food stored inside our intestine for 10 days and 15 days, it is not healthy. So we should have a normal bowel, which is more important. Now, which food I have almost finished my talk. You're welcome to pose your questions. The first one of the question here for me is which food item should be avoided to prevent individual from cancer? See, the food that we can avoid is a lot of salt, highly salted food, preserved food, food laden with pesticides. These are the foods that we should avoid. Any more questions? Dr. Visalakshi and Dr. Neetu, I have come to the close of my session. And yeah, if there are any questions that you want me to answer, I am most willing to.
Makes us learn better. I recommend the participants to type your query in the YouTube live chat and make the session more interesting and interactive.
Neetu, I didn't hear you. Can you repeat?
Yes, ma'am. Question, ma'am.
How would we know that this part of our body is affected by cancer? Yeah. Now, that is what I told you: a basic blood test, an X-ray, and all these investigations will give an idea that the body is which that particular part of the body is affected by cancer. Yes, cancer can be cured. We didn't talk about the treatment at all. There are three important treatments for cancer, and that is surgery, and the chemotherapy, and radiation therapy. Now, since Divya asked me about the cure, have to tell you that all cancers, all these three treatments might come one after the other, or all three of them would come in synchrony. We will do the surgery, follow it by chemotherapy along with radiation, or sometimes it would be the radiation first, will reduce the tumor size, and then maybe they will be operated and then given chemotherapy. It could be in any format, the treatment. It depends on which site, where is the cancer, etc. And yes, if it is treated properly, then definitely it can be cured. And the most important thing is in treatment, the medical oncologist, these are the specialists. See, now whenever somebody has a headache nowadays, I do hear a lot of people walking straight to a neurologist for an opinion. Even before consulting your general physician or an ophthalmologist, we go for a neurologist's opinion. But when it is cancer, or you feel there is something really wrong, and you are losing a lot of weight, or you're having a large growth in your breast, or you're having a big mass in your leg or in your back, we wait till that grows, and then we still go and meet a general surgeon. Or the specialities are specific. For oncology, we have a specific oncologist present. So there is a radiation oncologist, medical oncologist, and surgical oncologist. we do a specialization just on treating cancer. So you could always consult these specialists for treatment. So whenever we meet them, it is much simpler and easier for the treatment to commence fast, and the treatment would go in the way it is supposed to happen, and that will help in the cancer to be cured. What are the possible side effects of the treatment? And somebody wants to know exactly what is bone cancer is. Okay, first we will talk about what is bone cancer. Bone cancer can be, it is something called multiple myeloma. There are some bone sarcomas. There are variety of tumors in the bone. Now, these could be because of a various lot of reasons, which I cannot now elaborate. But there are various causes for any cancer. So, similarly, this bone cancer is also that. Now, whenever there is a cancer in the bone, sometimes if we are able to salvage, what salvage is treat, and that is sometimes we will have to do in certain cancers. If it is very extensive, we might have to do an amputation, follow it with chemotherapy and radiation too. Sometimes it might be just the radiation that is sufficient along with chemotherapy. Sometimes it might be extensive chemotherapy for a long period. And nowadays, there are new investigation modalities available. So, with all these things, we can detect a bone cancer quite early, and it is also possible to cure. What are the symptoms of skin cancer? Skin cancer, as I told you, it's an ulcer or something which is not healing quickly, and it could have some bleeding, it could have some thickness, and it could have some itching initially, and that is how it goes. It could ulcerate ultimately. So, that is what are the signs and symptoms for skin cancer. Possible side effects of treatment. What are the possible side effects for treatment is, in chemotherapy you could have some loss of appetite, some nausea, vomiting, and some people in certain chemos you will lose hair, but in many you might not. So that is another thing. And the other treatments are radiation therapy. Radiation therapy is given to a proper particular area. So only to that particular area it will affect. So the side effects are very minimal, except for some small skin discoloration. And surgery, any surgery takes its time to heal and come out. So that is the normal side effects. Any other questions? Yeah, Neetu and Dr. Visalakshi, if there are no more further questions, can we end the session?
Yes, ma'am.
Very much, ma'am.
Thankfully, it's the best form of courtesy.
Really, we are, yeah, really we are inspired, ma'am, for having your, presentation. I hope that it will be much more useful for us to be conscious about this cancer. And thank you very much, ma'am. Thank you. Yes, ma'am. Thank you all.
Thankfulness is the best form of courtesy. On behalf of the GSS Jain College of Women, I take this opportunity to propose the vote of thanks. I firstly thank all the Almighty God whose grace has made the state level health oriented webinar successful. I express my heartfelt thanks to our guest of honor, Dr. Sarita Ma'am, who has presided over the session and enabled us to acquire knowledge, keeping our hearts strong and healthy. Thank you, ma'am. We felt that it was very beneficial to us. I extend my gratitude to our principal, Dr. M.K. Malati, madam, and our correspondent, Dr. Gautam P. Ved, sir, for the guidance and support. I convey my heartfelt thanks to Dr. Vasalachi, ma'am, for her efforts in arranging this program. I also express my special thanks to all the faculties who have joined from GSS and other institutions. I also convey my heartfelt thanks to the parents for taking part. It is my duty to thank all my fellow students for their participation. Thank you all once again. The feedback form link is posted in the chat. Please kindly fill the form to receive your certificates. Let us pay
Yes.
tribute to
Thank you,
our
ma'am.
national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगल नायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे जनगण
Thank you, ma'am. Thank you, ma'am.